It is time for Help Monitor once again. Thank you so much for finding time to be with us. My name is Chibe Ologe. We have our usual segments for your help pleasure, assisted conception. Please stick with us. The show proper will return shortly.
My name is Dr. Olushola Akini. I am the medical director of True Care Fertility Clinic in Victoria Island. I'm a gynecologist and a fertility expert. I'm going to be talking on the issue of excess breast milk or inappropriate breast milk. This topic is important because of the misgivings of or misinterpretations of many women. Many times I've been called to ask for my opinion about how to dry up the breast milk, or while the breast milk, whether the breast milk is the one preventing some women from getting pregnant and so on and so forth. I want to say that first, let us look at prolactin. The importance of prolactin is that it suppresses ovulation. And we all know that if a woman does not ovulate, then there's nothing for the sperm to fertilize, and therefore pregnancy cannot occur. So when the prolactin in the body is high, women who have this condition do not normally ovulate. That is, ovulation is prevented. I want to say that there's a caveat to this. There's a difference between having excess prolactin in the blood and having excess milk coming out of the breast. There are two different things. The mistake that many women make is that when they notice excess milk coming out of the breast, then such milk must be high in their blood. This is not correct. Yes, it is true that for about 30% of those who have excess prolactin in their blood or their body, 30% of these patients also have excess milk coming out of the breast. That is, when we exclude breastfeeding, we call it inappropriate milk secretion or breast milk. I'm saying this so that we can know that the fact that you are lactating or you are bringing out milk in your breasts, or you have milk in your breast, when you press it, does not mean that the milk is high in your body or your blood. It's only in about 3 out of 10 women that this condition truly reflects what happens in the blood. And therefore, 7 out of 10 women who think that because they have excess milk in the breast, or they secrete milk when they press the breast, or they have inappropriate milk secretion. In 7 out of 10, when you test the milk in the blood, the prolactin in the blood will be normal, and which means that it is not responsible for their infertility problems. Let us talk about the type of milk that we are worried about. If a woman presses or compresses the nipple, there is a type of milk that will come out like what I would call snail water. It's clear, it's grayish, but it is thin. That is, it flows normally. That is not the type of milk that we're talking about. The type of milk that we talk about, when you see it, is a little bit thick and slightly yellowish. This is different from the milk that comes out when a woman has just delivered. That one is thicker. But what I'm saying is that when you have a clear fluid coming out when you squeeze your nipple, and it is not much, it is not in excess, that is not the type of milk that we talk about. We talk about a situation where a woman will just put on a bra, or even without that, milk begins to effuse from the nipple. That is the one that we call inappropriate milk secretion. But like I said, only in 3 out of every 10 women do suffer from this condition of hyperprolactinemia that suppresses ovulation. So it's only 3 out of 10 that you have this problem as a cause of why they don't ovulate. Remember that you're not ovulating is just one cause of why you may not get pregnant. Some people do not ovulate. Some do not ovulate and have their tubes blocked. Some do not ovulate and have one tube blocked. The other one is open, but it is not functional. Some have the womb cavity gummed together. A lot of things, so many conditions can present either singly or in combination. So my advice is that women should not believe that because milks come out of the breast, then it should be the cause of inability to achieve pregnancy. You need to get a doctor to look at your results. And aside from that, like I said, if you realize that even though you can have milk coming out of the breast, you can also have some other conditions that may need attention. All these things should work together. Pregnancy occurring is getting every condition right. Everything must come together to work for the common good of pregnancy before a woman can achieve pregnancy. Since there are 2 tubes, if a woman has one of the tubes blocked, then there is a theoretical 50% chance in getting pregnant. We've had a 62-year-old woman got pregnant with twins and delivered. Many women go from one hospital to the other, trying to cure what is not actually a disease.
That was Health Monitor for you again today. Thank you so much for watching. Please give us the feedback. Our social media handles are on the screen. Get in touch with us so that we can give you more information on the program. Thanks for watching. My name is Jibe Ologe. Catch you again next time on Health Monitor, your guide to good health.
Time again for Health Monitor, the #1 program that's all the health to live a life in its healthiest way, to improve the quality of health and life and inspire you and give you the hope that you can live a healthy life every day.